Welcome to the COVID-19 Financial Oversight Committee. It is Thursday, September 12th. We have a really full agenda, so we will keep going. I think we have one more person to join us. We'll get a chair for Vonda when she gets here. Thank you all for being here. This has been a very long road, and we are getting really close to the end. As you know, we have all of the funds are currently allocated, but as we identify funds that are remaining from some of those previous allocations, we have folks coming forward to say, can I use the funds this way instead of this way, or we find a new need. And so that's a little bit of what's on our agenda today. The first three are actually extensions of the contract. So they are not new funds. It is really that these folks have contracts in place with nonprofits, and we want to extend the date for which they can use those funds. So these should be pretty easy. The first one is actually internal. It's Office of Family Safety. I did not send it to you ahead of time, so it is a printout that looks like this. It is an email, and then there is a little spreadsheet attached to it. And the email really covers what they are doing. Just for a little bit of history, Office of Family Safety was actually one of our very first original allocations, and they've continued to use the funds and have actually been able to extend it even within their own use. To make sure that they've kept case managers, they've kept the waiting time down for families and individuals that have been impacted with the domestic violence and some of the other issues that hit hard during COVID. What they are asking for is to, they had an emergency fund, and you can see in that second sheet, the emergency fund was originally set at $200,000. As of, and these numbers on this remaining balance all the way to the right is as of August 8th. That's when essentially when their request came through. They have $157,000 still available, and they would like to take $99,930 from that fund, as well as $32,480 from some of the nonprofit contract fund, and transfer that to continue to use their case managers, which is their staff. So I included the spreadsheet so that you all can see. Wade actually went through right away, did all the math. They have plenty to support that transfer. And then they want to extend the contracts for these three. So currently the contracts expire September 30th for Agape, NCA, and Sexual Assault Center. And they want to not only extend those contracts through February of 25, but add enough funds to actually get through that. And they're actually adding funds that were already allocated to nonprofit contracts. So they're not taking that from anywhere else. What you can see there, just to make sure that's in the second half of the page on partner request. So there's still $263,980 available for those nonprofit partners. So it's a lot of numbers, lots of line items on the spreadsheet, but it's essentially the biggest piece is taking that almost $100,000 from the emergency fund, a little bit from nonprofits to continue their staffing of case managers, and then just adding to 3 of the contracts.
Move approval.
Second. Any other questions? All in favor?
Aye.
1, 2, 3, 4, 5, 6. Any no's? All right, 6 in favor, 0 against. Okay. That's the most complicated one of the contract extensions. Our place is really easy. If you remember, we extended a total of $500,000, and their contract is set to expire at September 30th. One of the things that we were funding was furniture for one of the new houses. Because there was a slight delay on the new house, it's going to open later, and they would prefer to use, they have $60,000 left. It's all for furniture. If they have to use it by September 30th, they'll pay some delivery fees and storage until they can move it into the house. If we extend the contract, they'll use all 60 for furniture and not have to do any storage and delivery.
Move approval.
Second.
Any other questions? All in favor?
Aye.
6 in favor, 0 against.
And I'll leave that.
Oh, perfect.
Oh,
Yes,
I'm
can I
sorry,
get-
going back, if the Office of Family Safety, I'm not sure, so that would need to go before council, so who do we?
For the contracts, yep.
So who do we want to be the?
I'll do that.
Okay. Thank you. And the third contract extension is for Big Brothers Big Sisters. They're just, because of the new semester starting with TSU, they're probably going to spend those stipends again. They're working with the TSU students to build them up as mentors for the kids, but also to help the students. And so they help them with stipends that kind of give them the opportunity to be that mentor. And so they think they will spend it through like early 2025. I recommended we just go ahead and extend it through 6/30 of 25 so that it actually gets them through the second semester, you know, should they need that time.
Second.
Any questions? All in favor?
Aye.
All right.
And if we need council approval, you want me to lead, Councilman Hammond?
Okay. All right, so now we're gonna talk about kind of reallocation of existing funds. The first one, actually, as we typed up the agenda, has changed. So I'm gonna go back to our May 15th meeting. If you recall, we had Angie Hubbard here from planning, and there was one significant resolution, but she actually had pulled together, there were two, and Tara, I'll be able to give you all the details for the actual. There was some pathways to equitable home ownership that the nonprofits that were originally identified to partner with when the funding was allocated later came back and said, we actually don't want to get into the middle of the federal funds. We're not sure we can spend them by time. So we reallocated that and we split it between the Strobel Center and Barnes Fund. We held back $500,000 from the Strobel Center allocation because we were expecting a request coming from Turk for New American Immigration Services. And Turk has come to us this week to let us know that while they're still interested, they don't think they can get the plans in place in time to meet the obligation, and therefore are not going to request those funds. So I think the best thing we can do is put them back to Strobel where they were originally identified. The need is still there. We have plenty of time to use the funds with Strobel Center. So we kind of made that change last minute at the May meeting, but the recommendation, the request is to take that $500,000 that we held back from Strobel and actually put it back to Strobel.
Move approval.
Second.
Any questions? All in favor?
Aye.
All right, 6 in favor, 0 against.
You want that, Councilman?
Yep.
All right. Next item is MDHA. And that was in, I sent 2 memos with your packet. The kind of summary of that. The biggest piece is, let's see, I'll tell you.
Oh, the Cumberland View and Casey?
Yep, Casey and
Gotcha.
Cumberland. So we allocated $15 million to MDHA. And $1.7 million was for some safety upgrades at Cumberland, and the other 13.3 was for infrastructure at Casey. They had originally split that 13.3 million into a sewer separation project for 7.5 million, and then 5.8 million for water, sewer, roads, sidewalks. So they were 2 separate projects. Since the allocation was made, once Metro Water Services got in there with MDHA and they've looked at the design and engineering, the estimated cost and the scale of construction has significantly exceeded the early projections. And so they have spent almost $1 million, $987,000 for the construction documents, which will go forward now as designed, so money well spent. But because they can't complete the project in the cost or time frame that they thought, they would like to use those remaining dollars, so essentially $5.6 million. They would like to shift that into, they will still use $1.9 million for that project, which leaves $5.6 million, and they just want to shift that to the second item, which is the water, sewer, roads, sidewalks. So it's taking $5.6 million from the first project to the second project. It's keeping it within Casey. It's keeping it with the intention of getting more affordable units out, built sooner. But it does shift it from one project at Casey to the other.
I have a question. Just, so first of all, just sort of, so what's going to happen with project number one in terms of whether it's going to proceed, and has a source of funding. And in the second, basically what we're doing is we're doubling the amount for that, and I assume that there was an initial plan for the $5.8 million allocated. Is there a revised plan? I mean, are we going to get twice the benefit and twice the improvements, or is that going to just be a general allocation that we hope a plan will be developed?
No, that's a great question. Both of these projects were contemplated in our capital spending plan. So there were going to be funds available at a certain date for these. What allocating the ARP funds did was allow them to start sooner. So the idea was to get the affordable units out of the ground sooner. So what it means is now the first project will have to really tap into that capital spending plan as originally planned. The funds will be there, and it's just going to take longer. It means that the second project can actually be completed even sooner because it has even more funds to it. So they're really the same projects. It's more about timing.
Gotcha.
So,
Go ahead, sorry.
no, you have a question. So to her question of, the project itself is not expanding, it's just the costs themselves for the existing have
More will come from ARP than CSP. And then on the first project, more will come from CSP.
but the problem is just that the costs have exceeded and
Yes.
and the timing has been, okay,
On the first one.
yeah.
Move for approval.
Second.
Any other questions? All in favor?
Aye.
All right, 7 in favor, 0 against.
I'll read it. Okay.
Thank you. All right, WeGo. So this one, I sent this in the packet if you have it. Pretty simple. We had allocated $400,125 for our HBCUs to be able to access WeGo, as part of a program to provide free rides. It's actually been great. What happened is what we did originally was actually list an amount for each school, and what happened is Meharry is getting to the end of their dollar amount, and TSU. So it was originally 230.
This.
Oh, thank you. Sorry. Nope, you're good. I'm going to go back. This doesn't necessarily require a vote. Sorry, there were two parts to MDHA. Thank you. The second piece on MDHA, what I sent you, was for Cumberland. And that was back to that $1.7 million that we had allocated for safety. And it was originally identified as improved lighting, traffic calming, sidewalks, and additional safety needs in the community. After they completed the lighting, the traffic calming, and the sidewalks, they still have these additional funds. And so they spent $911,000, they still have $789,000. And they came to us just saying, are you okay with this expanded definition of safety? And I said, well, as long as we are coming to the committee with the reallocation from the two different projects, let's just let them know that we are expanding the definition. So we're expanding the definition of the additional safety needs. There is some space renovation that's gonna allow a community gathering room, upgrades to the basketball courts, second page.
Sidewalk
Oh,
fence.
the fences, tree trimming, some signage, and windows. We technically don't need a vote, but we had the opportunity to make sure that if anybody had any questions or concerns, that, this would be an opportunity to say, hey, that's not what we thought the original definition of safety was. Does anybody have any questions or concerns to go back to MDHA?
I think this is a great expansion of those
Yeah.
funds.
I do too.
Yeah, it was great that they had enough left to keep going, so. And I thought MDHA did a great job. They had done a survey back in 2020, and they really were able to correlate what the residents wanted.
Right.
And so, okay, good, but thank you, I wanted that on the official record,
Yep,
so.
move approval.
Good deal.
But we don't have to have
We don't really
legislation
have to
for that,
vote.
it's just
Yeah, it's really
Okay.
just,
Information.
a thing.
I always try, if somebody comes and says, hey, does this meet the definition of our safety? It's not really something that had to come back to the committee, but I always just like to make sure that this isn't, Mary Jo behind the scenes saying everything's okay.
Yeah.
Making sure you all know. Okay, back to WeGo. So we had identified dollar amounts to the different schools, and the vast majority had been to TSU. So they had almost 239,000 versus Fisk at 30, Meharry at 25, American Baptist College at 6,250. And Meharry is kind of running out of their allotment, and because the legislation actually listed dollar amounts, technically we have to come back and reallocate within the amounts. And what I would suggest, we have 159,000 as of 6:30. So we've used some of that now that summer and school have kicked off. I would just say with the remaining funds, that all the 4 schools can access the funds until they're, depleted, rather than reassigning a dollar amount, because we do this and then Fisk is gonna end up needing a little bit. So I thought rather than pegging a dollar amount to each, that the remaining balance can be used by all 4 schools, and it just simplifies it.
And how much is that again?
There's, the dollar amount was as of 6:30, there was 159,000 left. So that amount would be lower today, but there's still plenty to shift so that all schools can access the total fund, rather than having like 4 separate amounts.
And this would go through the end of 2026.
It'll be available until then,
Okay.
if they don't deplete it before then, because the original was 400,000. So I don't think it'll last till 12/31/26, but that's the date they have it.
Yeah, Mary Jo, my question was just whether or not we have a sense of, whether all 4 schools are using the program, whether there are any sort of discrepancies maybe in terms of how we're promoting it, or just, whether it's successful at all 4 in terms of getting the word out. I mean, obviously TSU is going to be the bulk of
Yeah.
it, but I love having the flexibility to allocate it, but I also just was curious as to how it's going. It seems like the total number spent is very good.
It is good, and I'll say I didn't hear specific comments with American Baptist College, but that with the other 3, it was getting well used, and there was a little bit of a pleasant surprise that it became something that Meharry students are really using quite a bit, more so than I think they thought they would. Hence can we put a little bit more into their total? This is a little bit off this, but I think WeGo's done a really good job trying to promote all of the use. I mean, even, I don't know if you saw now on Titans game days, everybody can ride, free. So I think there's just been a lot of attention to trying to increase usage.
Yeah, I hear radio ads frequently about this program. You're doing a great job.
Excellent, okay. So the way we will draft the amendment to the original resolution will essentially lift the dollar amounts assigned and just say all funds for these schools. Any questions?
Move for approval.
Second.
All in favor?
Aye.
Great.
Code Gamble.
Please.
All right, y'all are flying through these. Send it quick.
Because you got us
text.
fresh in the morning.
I know, this is good. This is a new strategy. We're gonna move all, you know,
You
we
provide
don't have
coffee
many
really
left,
fast.
but, had I known.
Oh.
Just perfect timing, I picked up my phone to let you know we're flying through the agenda.
Wow, I would have come up sooner.
Dun, dun, dun. Okay, next item. I do have, let's see, wait, did you give them the,
Business office.
yes, and the, excess
Yes.
spreadsheet, okay. I'm digging through my paper, sorry, because this was something that wasn't in your packet that I emailed. I'm gonna let you know what you see here, okay. These are the two pieces of paper that we're working off of. So, we've got the Mayor's Office of Advancement, and then to know where that funding's coming from, you've got a spreadsheet with some green on it. So, as we said, there's a few projects that that have finished. I mean, more than a few have finished, that's good. But some of our allocated funds, we've identified through the monthly reports, and folks have said, we're now finished. And we have funds left that were obligated to us that we know we're not going to need.
Just do sneeze.
Oh, you're good. So that is the basis for the little spreadsheet that's got the green, which is identifying where we know we have funds that are left to be reallocated. So you'll see like the rental trash trucks, if you remember, we allocated funds, they leased trash trucks, simply have almost $8,600 left. We had Fuse Fellowships, it was originally $150, that's the $12,000 that was left. Fire department had $1,700 left with fleet. And then also OEM had funding for a shower, you know, the trailers, the cardiac monitors. So when you add up all of the different items that were left over, oh, I'm sorry, I did see, on the 205, it says only needed 145. That was the market
Market value analysis.
market value
for planning.
analysis for economic community and development. Sorry, I was gonna change that, so it's a little more descriptive. So these are the amounts that have been identified, so that's 803,000. The vast majority of that, we're looking at this next item on the agenda, but I just wanted to kind of put a context around where the funding is. Marjorie's here, I'll let her actually let you all know from the mayor's office the idea behind an Office of Advancement and Strategic Partnership.
So not long after joining Mayor O'Connell's administration, I in a crash course lesson in funding things in government, I discovered that there's probably not enough money anywhere to do all the things that the city would like to do, that the mayor would like to achieve, that we want to do to help the people of our community. Coming from a nonprofit background, I'm aware that there are a lot of opportunities that you can take advantage of if you approach it in a systematic way. And so I started thinking about looking at how many team members in the mayor's office who are spending time writing grants, looking for grants, applying for grants when they could be doing implementation of the work that they're assigned. It occurred to me that if we had a team of people who could be forward-facing, look for ways to win and build relationships with philanthropic organizations, corporate partners, while also looking for and pursuing federal and state grant funding on behalf of all these initiatives and things that we want to achieve, collaborate with departments to, in a systematic way, pursue opportunities that with funding, we could generate more revenue than we would ever possibly expend. And so I started writing an idea. I started digging around and doing some research, and I couldn't really find many examples of other cities that are doing this kind of work. But I did find in the city of Detroit an Office of Development and Grants. And after conversations with their director and their team, I realized that they've been doing this since 2015. And obviously, the city of Detroit was coming out of bankruptcy at the time. There was a lot of interest in doing grant funding for the city, and so they kind of had a leg up in this process. The only other city that I could find that's actively doing this is the city of New York. Detroit has a team of 6 that do this work. Detroit has 60 people doing this work. And none of them could really identify any other cities that are doing this in a systematic way. But I did find that the counties that surround Detroit decided this was a really great idea, and they're starting to, with Detroit's help, to approach this work in this way. Detroit itself, since its inception, they estimate that their team has touched over $1.5 billion on behalf of the city, and that includes $60 million in federal grant funding that they've gotten in the last 3 months. So this is a revenue-generating opportunity. The idea to incubate this in the mayor's office, we have a history in Nashville of incubating ideas in the mayor's office and then launching them into the world to do their thing. The Office of Family Safety is a really good example of that work. So I am asking you kind people to consider helping us with some money to establish an office, knowing that it's one-time funding, but also understanding that this would be revenue generating, that it would either generate administrative costs to cover the costs, but also that it would benefit the city in a way that we could all see investing in this in the future in a budget. Thoughts, questions?
Go ahead.
Okay, Johnson. Thanks. So we've had a conversation about this outside, and so I just wanted to put it on the record. The concerns that I had, they have been met. I am in favor, but I think it's worth articulating so that people can understand sort of the thought process behind it. So I agree with having sort of that consolidated effort and having people that, that's a really niche talent is grant writing. It's a whole different world. And so having that there and having, a relationship building and all that. My first concern was, why would it be in the mayor's office? Why not be in the finance department? Finance does compliance review for grant things, which would cause that conflict of interest. So that made sense to me. So then we went back. So, okay, mayor's office makes sense.
You beat me to it.
One of the things that I was concerned about is having $763,595 that we're allocating. We have to have everything allocated by 12/31 of this year. And once that's done, that's it, whether they can spend it or not. And so we couldn't come back. So I had that concern with Mary Jo. They know that they have to make these hires before 12/31, so that we know, what's going on, and we will have a plan. If we aren't able to make these 3 hires, that the money comes back, and we'll have sort of contingency plan. So I'm not worried about that. But I appreciate, I think anytime we are looking for diversified revenue sources, that takes the burden off of our taxpayers. Nobody wants to raise taxes, but money has to come from somewhere. And so I appreciate this effort, and I'm in full support.
Thank you.
You had a question? So because of the restriction on the end of 26 of when this has to be expended, what is the concept about what goes on after that? Is it that these people have generated enough revenue that they can just self-support themselves in future budgets, or what's this?
And in talking with, historically, in talking with Detroit in particular, they said that is exactly what happened. She said, I asked her, I said, today, if you suddenly were removed from the budget, she said, oh, I have ample funding from the grants that we obtained. The administrative costs would more than cover what we have. She said, I could probably cover it 3 times over easily. And so the idea is that, A, it is self-sustaining, but also that we see this as an investment. My hope is incubate this like we have other projects. Have it be, when this mayor's administration ends, whether that's 3 or hopefully 7 years, I hope that this is still standing someplace outside of the mayor's office and funding itself, and or you all see and the community sees the value that it gets budgeted. And that's my hope.
It's interesting because one of the things I've certainly learned through this process is how it's so difficult for people to tap into state or federal funding that may be available, and we've learned about large amounts that were unspent because of that difficulty in communication and program support. And having worked a lot in the nonprofit sector, I agree, this is a great way to try to take what's left of our art funding and make it grow. So I think it's a great opportunity, and I hope it will self-sustain for a long term.
That's the goal.
I have a couple of questions. Grant writing has been a problem in Metro for a very long time in several different departments.
I've been trying to figure out who has grant writers, and no one can give me a number.
And that's the thing, right? And even some of the grants that we have written in specific departments have not met specific standards when compared to peer cities. When, like, NDOT being an example, right? They have a lot going on, granted, and when you look at other cities around our size, they received more funding than we did. So I guess my question is, would these grant writers, this team, be coordinating with different departments?
That's the goal, 100%. One, I think a lot of those cities who are taking advantage of or receiving more opportunities, they're probably utilizing better technology than we have. And I've had conversations with the grant administration and finance team to talk about how we can utilize tools to find more. And there are opportunities. I had a great demo of a product with Kevin Brown recently that kind of blew both of our minds about how you find things. That kind of technology would allow us to coordinate and collaborate actively with the departments. But the goal for this is, hopefully we pass transit in November. Those are going to be implemented by other departments. We're going to have to go and find funding for them. So we would be working on behalf of those types of projects. And additionally, I mean, one of the things that has concerned me is that a lot of times grant writing tends to benefit those who have the most opportunity for seeking it, and we leave communities behind. And this would be focused also on finding opportunities to help other parts of our community that don't always get the attention that it deserves. So to and through departments, but also independent of that, looking for philanthropic opportunity, corporate opportunity. And we're doing that in the mayor's office now. I'd love for the 3 people who are actively writing grants right now to have an opportunity to do other things and implement those programs. But yeah, the idea, we have, we're tracking on an Excel spreadsheet the grants that the departments are chasing. I am not even joking with you. Sorry about that. And so this is the plan. Coordinate, collaborate with the departments to help them find more opportunity while also looking for things that maybe we haven't ever considered before.
I just make a comment. I think this is a great idea to have better coordination, and as you said, if transit passes, this will just get us ready for.
That's just the biggest example.
That's just the biggest one. But I'm just thinking about parks. Just applied for a grant affecting the park in my district, and I think it's great that they are applying for it. But I'd like to see more of that. I mean, that kind of came out of the blue, and so. There's a lot of opportunity there that we are just leaving on the table and not even seeking because we don't have this coordinated effort. So I think this will help in that.
Well, everyone's working in a silo as well. I mean, I can't count the number of emails and DocuSigns that we get in the mayor's office to sign off on something because someone found out about a grant, and they have a deadline and it's tomorrow and we have to sign off on it. But what would have happened if we'd been able to have multiple departments coordinate on that? Could we have, to your point, achieved an opportunity to gather more money? Yeah. The idea is just to build something that will help all of Metro and all of the city.
Any other questions?
No, I was just gonna make one more comment, sorry. That having it in the mayor's office was one concern, just because that office turns over every 4 or 8 years. And so to have some consistency there, having it its own department, I do agree with having the pilot be sort of housed there and incubated there, but once it gets on its own, I would love probably to see that be its own department and grow. But yeah, I mean, I also think hopefully we'll start seeing more grants coming through, which creates more legislation, because right now we have to say, yes, we approve that you are going to apply for this grant, and then when we get the grant, then we have to say, yes, we agree that we are going to accept those funds. I think there's a way that we can legislatively sort of streamline that so that you say, we have permission to apply for it, and if we get it, you know what I mean? Like, let's do a 2-in-1.
A twofer.
Yeah.
Okay. I will take that back downstairs if you all approve and this moves forward.
I
I'm
think
happy
that's
to
something
do
that, yeah, we don't, it's insanity.
Why would you not take it if you get it?
If we don't plan on,
Why do you
if we
have
don't
to
plan on
run?
accepting the funds, why would we approve applying for it? It makes no sense. So anyway, that's just my
Well,
own.
and the goal here, I mean, look, I'm not gonna be here forever. My goal is to leave something that helps the city when this administration is gone. We all know what it's like when
Second.
turnover in the mayor's office.
All right, I have a motion for approval, a second. Any questions? All in favor?
Aye.
All right.
Forget who's taking?
All right,
Okay.
got that. Okay, and then, 7 in favor, 0 against. Alderman Campbell. Okay, so then the last item is related to our spreadsheet, which shows we have $39,000 that we've identified as available that we should obligate. And I'm gonna talk a little bit about the final obligation process. So with the last piece, the $39,708 that's left to allocate. Once that happens, we would then have taken, so right now, all of, $259,810,600, okay, that's our total. It's all obligated. What we've done is shift some of it today. What this last $39,708 is the last known piece that we have today that we should re-obligate. That puts us back to all $259,810,600 obligated. When we hit that 12/31/24 deadline then for obligation, what that means is we cannot introduce any new scopes of work. We can't introduce any new programs or projects, but we do have the ability after 12/31 to reallocate funds to items that are already obligated. So, pick something we've done today. If for some reason, as we near 12/31/26, we go bus funds left. We don't want to lose them, but we would be able to shift them to something else that could be spent. So, the WeGo example is a small dollar amount, but let's go back to the MDHA where we've now taken a $5.8 million project and doubled it. If there's $2 million left because of construction delays, we don't want to lose that $2 million. I don't think we'll have something quite that large, but it could happen, right? So what we want to do is make an obligation for something that we know has the flexibility to have been spent. We can't have on December 15th, somebody comes and tells us, hey, I got $2 million left. Well, it's kind of hard to spend that at the last minute. But if we obligate to something that we know over the last 2 years, like from 12/31, say from January 1st, 25 through 12/31/26, that has been spent, then we just shift journal entries and it's spent and we're done. We don't return anything to the U.S. Treasury. So in talking to the mayor's office, and our council members will be a little bit more familiar with this, we have the REACH program, which is out of our fire and OEM, and it's similar to our Partners in Care, but REACH is really an opportunity where we're dealing with responders, helping with mental health and other crisis that may not be traditional sickness, right? It's all more about our mental health. During our budget process, there was a request for an ambulance that had wheelchair capability, and just expanding our REACH program, much as with Partners in Care, which is with our police department, and addressing, in that case for folks, we have a mental health professional that rides with our MNPD, And so trying to eliminate arrests and cases where it's really a mental health issue and not a criminal issue. So that was a pilot that got funded through ARP, and then we've been able to put that into budget year after year. With REACH, we have a pilot program going on. It's going very well. We'd like to expand it. We weren't able to expand it completely in this year's budget. So we would like to take this last $39,708 and allocate that to expanding our REACH program, but also providing our public health and safety salaries. And that becomes, if you remember, kind of our default. And we did that with the CARES Act. Now, with the CARES Act, I'll just say, we did it to create a reserve to extend the use of funds. That's not what we're proposing here. What we're proposing is that if monies get shifted after the obligation, if another program needs it to complete, great, we can shift it there. But if at the end of the day or last minute, we get notified that there's funds, we need something that we know we've spent, and we know that we will spend public health and safety. So the priority of this allocation is REACH and the expansion of REACH. But if we hit those goals and we need, then we want to match that REACH program with our public health and safety salaries. And so right now, we'd be proposing $39,708. As additional funds become identified, just like we did here, as some of the programs start to end and there's money, we'd like to be able to shift enough to get that ambulance and expand the program. And then if it goes even further, we have public health and public safety salaries. So that would be the request, to put that obligation in place, and then this committee would be finished obligating.
Move approval.
Second?
Yep, second.
Any questions, concerns? All in favor?
Oh, hold on, I have questions.
Yeah.
Okay, so we're putting it into public health and safety. Those funds have already.
REACH.
And REACH, right? So it's going to REACH, it's going to the ambulance. If funds exceed those two, then it would go to public health and safety.
Mm-hmm.
But we're already paying public health and safety salaries.
Correct.
So what is the extra?
Yep, so what would happen is essentially the budgeted amount for those public health and safeties would go unspent.
Okay.
And for what does that mean at the end of a budget year? Those dollars fall to the general fund.
Yeah.
And Metro has a general fund policy that allows, as long as we have reserves and our debt policy, as long as we have a fund balance policy for kind of our non-council members, then those could be one-time spent funds.
I'm good.
Okay. Any other questions? All in favor?
Aye.
Any opposed? All right, 7 in favor. Am I counting you, Sean, or do you? I can make it 6. We're still good.
I mentioned that finance approval for
I do. Okay, 7 in favor, 0 against. So then the last item is the reporting updates and the interagency agreements. And I just want this committee to know where that's heading. We've talked about obligations. This has all been about obligating the funds by 12/31/24. So we now have them all obligated, and between now and December, well, let me back up. What's going to happen is we have to actually have an interagency agreement that shows all of this obligation that's not under a contract. So all of our nonprofit contracts, the U.S. Treasury accepts as proof of obligation. The Treasury decided that legislation, like our resolutions and ordinances, do not represent obligations. So, but they will acknowledge an interagency agreement, or think of an interagency MOU. So we are going to actually draft an interagency agreement for every department that has unspent funds. And we're using 9/30 as the deadline. So if you don't have your funds spent by 9:30, we are gonna go ahead, we're gonna draft an interagency agreement that says the finance department allocated to Office of Family Safety this much money, here's what's left at 9:30, and here's the scope of work that was approved by, first by this committee, then by council, to do that work through 12/31/26. It's a lot of administrative paperwork. It doesn't change anything that this committee, so once these final decisions that we just made today are approved by council, we're just incorporating all of those into one more large resolution. So that will be, I think our plan is the November 5th council meeting, so it's just gonna take between now and then to get the 9:30 balances, get all of that drafted. And by that time then, all of these that we did today are passed by council. So after that, within that November 5th resolution, we are proposing that it will say, any shifts within the obligations will be approved by the finance department. So it means this committee doesn't have to approve any more shifts, because it can't be a new project. It's everything you've already heard about. It also means we don't have to take it back to council, so that we're not constantly updating these interagency agreements with shifts. And so what that leads to then is you'll continue to see it in our quarterly reporting, you'll see it in our annual reports, but the committee doesn't actually have to make any more approvals, and nor would council. So that's what will be in that resolution. If council wants to change that, they'll have that opportunity on the, at the time that that legislation is filed. But unless there's any other objections, that's how those interagency agreements will go. And then just a reminder, what I will do then is actually, we post the quarterly project and expenditure reports to the website. I can PDF those and send them to the committee so that you all will have those, so you will continue to see that. And then the annual one is a little bit large. This past year, we really expanded it. All the kudos to Wade. It looks really good, and I sent you all that link, and it's long. It's 140.
About, yeah.
Yeah, so it's not something you're gonna sit and read through cover to cover in one sitting, but you'll really get an idea of what's in there. And it was important to us as we looked, again, I've said this a lot, transparency was always so important through this process. We also didn't wanna risk any of our funds, and so we elected the most flexible reporting with US Treasury, which was to report most of this as revenue replacement. So we used the expenditure categories to guide the decisions, but we didn't report under expenditure categories to US Treasury. Very common for all of the large cities. They all kind of decided it was a burden, it was a risk. That if we didn't dot an I or cross a T on an affordable housing project, then under audit, could they come back and say, no, those weren't valid? So to eliminate all of that risk, we did the most flexible, which is revenue replacement. But we didn't want those final reports to then be the only thing that the public could see. So when you see that recovery report, it has every single project that we approved and that we funded. And so it represents the full investment that this city made. We never wanted to say, what did we ever do with that $259 million? So it is all laid out there. The departments and the nonprofits have been held to all of their interim reporting. They report to us every 6 months, updates. When we asked them for zip codes and demographics and results, they've reported them, and that's all in there now. So it was that was a big lift, and Wade did all of that, and it looks really good, and it will just continue to get updated now on an annual basis. So it's always as of June 30th, it's due July 31st. We post it to the website, you'll see that. But it really does memorialize all of the work that this committee did to listen to all of the presentations and decide what the best investment was for those funds. So I do encourage you to pay attention to that.
Can I ask a question?
Yeah.
I haven't obviously gone through that, but
Yeah.
it sounds like a great record of all of our investments. And obviously our investments have laid out our priorities. But, one of the things I know that we said a lot in the early days was, we don't want to be here 5-10 years down the road and have nothing to show for these investments. And is there going to be a way to capture, it's going to take some time, but capture maybe the number, whether it be small businesses helped or affordable housing units or the impact on the homeless situation in Nashville, something that summarizes the results, not just the investments.
Yeah, so that's what, in each program as listed, it's giving those results. So it will say this many rehoused from the encampments, this many families were given rent. We kind of have to go back. We forget how long we've been at this. But there was a tremendous rent relief program. And so all of that is in the details. I do think you raise a good point about how can we make maybe a summary that's visually attractive, summarizes some of the programs, and brings it to a higher level, because not everybody's going to read 140 pages. So we've actually even talked to the mayor's office. There's somebody in the performance team that would like to kind of look at, that one-page summary that is graphic and detailed, and I know that will come with it. But in the meantime, the detail's all there, and I think by the time we get to the end, we'll, want something that's a little bit more digestible.
Yeah.
Yeah.
The dashboard.
Exactly. There's some really good examples out there, not so much, when I think of it, not so much from ARP, but just things that I've seen, from a nonprofit and community perspective, where you can wrap up a year. Well, we'll be wrapping up probably about 6 years. So any other questions on that reporting? That will continue to come to you, but unless there's any kind of curveball or, something that changes, the obligations have now been complete, and it's that last piece that if we have excess in the other obligations, that we will shift that to that reach to make sure we get that program fully, funded, as well as then we'd have the backstop of any public and health and safety
I have
salaries.
a question. Does the reporting go all the way back to CARES? Because we had the 259 for ARP.
Yes.
And then the 3, what do we have?
Well, you know what? Yeah, we had
$121.
$121,122,770.70. Things I will not ever get out of my mind. But you know what? The CARES Act report is not on the website. I would be happy to add that. What the link that I sent you, you'll see it says American Rescue Plan, and it lists the reports. I should add the CARES. Yeah.
Different phone.
Yeah, they're very different. But yeah, that's a
We didn't
good.
have all the reporting for the
That would
CARES.
get
I
you
don't
to
think.
me, but it's easier to do.
Still, we make those investments. So.
It does, because it really is a combination of both of those.
Yep.
Good, all right. Thank you all. Any other questions? We are adjourned.
Mary Jo, you confused me saying, public health